Okay. Well, good afternoon, everyone. I'm Scott Mullaney. With me, Dr. Bill Coase. Our third installment talking about COVID and related issues. As in the past, our goal today is to provide education, answer questions. I have to say, I wasn't supposed to wear a striped shirt. I forgot and did that. As a result, I've learned a brand new word today, miore. So if I create miore for you, I apologize. This is certainly not my goal.
You better explain what miore means, Scott.
I don't even know how to describe it. It's when you look at a stripe and it kind of looks like it's moving around or something along those lines. Thanks a lot, Bill.
Yeah, you're welcome.
We have a number of questions again, which tells us that we are providing some insights that are useful. I think as long as questions can continue to come in, hopefully the community will find this valuable. So we'll get right to the questions. Tiffany from Tiffin, Ohio is asking us, how many tests, COVID tests, have you swabbed and what are the results so far? Bill?
So I've got some updated numbers. We're going to be talking a lot about testing today from various aspects, but specifically related to this question, we sent out 474 tests. Of those tests, 409 have come back negative and 54 have returned positive. And in addition to that, that's not just Hancock County. We've tested from 15 counties that pretty much surround us.
One of the oddities of this whole process, and we don't have to go into a lot of detail, is that the results get reported through the county the person lives in. They don't have to get tested in the county they live in. So if we're doing a different county and they're positive, that would get reported through their county. Second question, Thomas from Finley. And by the way, we do appreciate these questions very much. How many COVID-19 cases are currently hospitalized in our hospitals, Bluffton and Finley, and are any of them on ventilators?
Altogether, we have 8 in the hospital, either that are positive, which there's number is 5, and we have 3 that are under investigation. We also have 1 individual that's on a ventilator at the present time.
One of the questions I get asked a lot is how many deaths have you had? The answer is 1 so far, which is 1 too many, but I have to tell you, all in all, we're thankful that that number is as low as it is. John from Finley is asking, why does it take up to 3 days to get test results for COVID-19 back? And we'll answer that. I'll have Bill answer that for you, but some of you may have remembered this. Initially, when we were sending tests out to California, it sometimes took 7 to 10 days. So the process has gotten much better. Bill?
This might be a place to just talk about testing in general, about the process or the procedure. This is not a blood test. This is not something so simple that we just take a part of blood and send it somewhere and have it analyzed. There is a definite procedure of doing a deep nasal swab. A part of I think the confusion, frustration, et cetera, with testing has been, have we done those properly? This is across the nation as to what has occurred. So when someone is going to have the test done, the person that is taking it, because they've met criteria to be swabbed or to look for the test, they're in full protective gear. So someone has to be dressed to appropriately do that for their own safety. After the swab is taken, then it needs to be put in a broth or in a media immediately to make sure that it's a good specimen. And one of the big problems about testing, we're going to talk about that probably a little bit later, we have availability of testing, but where we've had the problem is getting the media or the broth to be able to put the viral sample into to be able to send it. And then from there, it needs to be sent somewhere. As Scott said, we have been using the Ohio Department of Health. We've used Toledo. We're now working with Mayo Clinic. We are running those tests up there, but then it takes a while for the test to be run. Again, it's not a simple, just put it in an analyzer and come back with what your blood count is or anything like that. So we have specifically sent those places where we're getting good turnarounds. And now if we can get them out by noon, we think we will probably have them back the next evening. Overall, it's somewhere between 36 and 48 hours that we get tests back. And I think that's fairly appropriate, and it's also what's being done across the nation.
So here's a question. Scott from Finley asks, what are the chances that Blanchard Valley is going to do testing in its lab? By the way, that Scott is me.
Thank you for the question, Scott. And I also know the answer to that question. Thank you for asking something I knew.
Setting you right up.
Yep. So we have been working on that in our laboratory. The problem is, not just from our laboratory standpoint, this is a very sophisticated test. And so you need the media to be properly prepared, as I talked about. But in addition to that, then you need reagents in a specialized machine that will analyze it and come back with an evaluation that essentially is returned as negative or as positive. And all I can say is pretty specific because it's looking for specific antigen traceability. What we have done, Scott's comment, is we've purchased a machine that will be able to do 8 tests in a day, and that tells you how long it takes for the test to run through the procedure. We also have another machine that will be able to do 4. So hopefully pretty soon, once we go through our quality evaluation that we're in the process of now, we should be able next week, we hope to start being able to do 12 tests here, which will have a much quicker turnaround than when we send things out.
You said 8 in a day. It's actually not in a day, is it?
I thought the new machine, that may not be right, was
okay.
8.
All right. Well,
because that's the number of cartridges plus the other 4, so we'd have 12.
I guess the point is, Blanchard Valley is going to be in the testing game here relatively soon. Our lab director is a woman named Bonnie Van Scoik, and Bonnie has put in many, many hours. She's had to be pretty aggressive with vendors, finally gotten us to where we can do this. So we believe we're getting closer and closer to having more control over it ourselves, which is a really good thing.
Yeah, and you may be right that we may be the turnaround that's how many we can do at a time. We may be able to do more than that a day.
Well, whatever, we're going to be in the testing game. Stephanie from Leipzig. Stephanie, thanks for this question. What does it mean for someone to have recovered from COVID-19? How long do you have to be symptom-free? And I guess you could probably add to this question, is it possible to get it again?
Well, that's a difficult question to answer. I'll answer what we generally think as far as the scientific theory. So when you talk about the theory of what has happened with a viral infection is, if you think about it, you've got a virus that goes into a person. So if this virus would go into Scott, there's an amount of virus that he's going to be exposed to that will infect him. In addition, he has a response to that. And how does the body respond to any kind of infection? Well, basically, we fight it with different chemicals or cells that we have in our body. White blood cells fight infections. In addition to that, we have different kinds of white blood cells. You may have heard of lymphocytes. There's B lymphocytes and T lymphocytes. Without getting into a lot of detail about that, those cells make antibodies that fight the infection. And there's different kinds of antibodies that are produced, immunoglobulins. When that occurs, it depends, and again, if I'm going to use Scott, when the virus comes in, if he didn't get a big viral load, he may be able to fight it fairly quickly without producing a lot of immunoglobulins. It just makes sense. If you didn't have a lot of infection, you didn't have to spend a lot of time.
It's not that big of a fight.
Your body didn't have to spend. So those immunoglobulins are not as high of levels as what they might have been had he had a lot more infection. So when you try to answer the question, can you get it again? Well, we don't think so, but it depends on the virus. If you talk about measles, people don't get measles twice, but we all know that you can get flu twice. Influenza, really you have production of immunoglobulins that last for about 5 to 6 months, and then you may get it again. We've only been dealing with this novel coronavirus for the last 4 months, so we really don't know. There have been a couple of studies out of China that would indicate that people have got the infection again. Now, the question you would ask scientifically to try to answer that would be, well, first, was the test good? The first test that you thought somebody had it, because we didn't have any standard to work against. People have been working on the fly, trying to figure out what's happened. And then the second thing is, maybe you did get it again, but your immune system didn't produce the immunoglobulins, or maybe they weren't high enough. Long answer, we really don't know, but we don't think in general that people are going to get this twice.
I read the story today about a guy that has had virtually no symptoms, and yet he's tested positive for 40 days.
Yeah, and so part of, now there's two kinds of tests that we can talk about. There's the antigen test. So when someone comes in and we're testing now, what we're looking for is, are you actively carrying the virus? And the concern about it is, one of the things is that's when you're infectious. And I think that was part of the question that I didn't answer, is that we think it's usually in viruses 2 to 3 days before I get the symptoms. But there is data to show with this virus, it may be up to 4 to 5 days before you show symptoms, which makes it much more difficult, obviously, to detect. And the reason for the 14-day quarantine was most people are not shedding the virus after 14 days of symptoms beginning. Usually, we think it's less than 10 days, peaking somewhere around 7 or 8 days, at least the last data I saw, but 14 days protects that. But I could see if someone's immune system was not fighting the infection well, that someone could carry and be actively shedding for 40 days. A lot of people have heard of what typhoid Mary was. I mean, that was back 100 years ago. People would get typhoid. She's the characteristic of epidemics. And she carried, now that was a bacteria, but she carried that with her all of her life. She never got rid of it, never was sick, but gave it to hundreds of people.
Stay away from typhoid Mary.
I think a lot of people tried to. She ended up being imprisoned because she wouldn't have stayed away from everybody.
That's another story for another day. Marie from Van Buren asks, is it safe for me to come into Physicians Plus or the emergency room for a non-COVID related issue? And what measures are being taken to ensure that I won't get sick when I come there?
That's a fair question. And that is a really concerning question for a couple of reasons. So let me say first, I think we have done everything that we can, and then maybe in addition to that, to try to make this as safe a place as what we can. So we still monitor everyone that comes into the hospital. We have restricted visitors. When I say monitor, we take their temperature. We ask them if they have any symptoms of what could be perceived as any kind of infection, not just COVID. We have hand sanitizers around, along with the restrictions of visitors. In addition to that, we're sanitizing our rooms whenever anybody goes into that. So we're working as hard as we can to make sure it's as safe from any infection. In addition to all of the protective gear we give, a visitor comes in, we put them in a mask, and then we make sure that we're in protective gear so we can't be passing that back and forth to people. The question about not just P plus in the emergency room, but any place here is, and I'm sure because we have, I think as a healthcare, we've scared people that they social distance, that they've done things. Therefore, and understandably again, well, I don't know if I want to go to the hospital where I could pick up something. I've tried to answer that question. The other part of that is across the nation, I don't know that we have data here that we could say that, but certainly it happened in New York City, that there was a much higher incidence of people dying at home with strokes and with heart attacks because they avoided going to an emergency room with symptoms that should have been seen because they were concerned about getting COVID. Now, we don't have as high of incidence of that. So it's a really good question. We are open. The emergency room is open. We get phone calls. Is the emergency room open? P plus is open. Doctor's offices are open. You should call and talk if you have any questions about that, but we need to see you.
Couple other quick points. As far as we know, no Blanchard Valley associate has contracted COVID yet. Any COVID patient we've had in the hospital is in something called a negative air pressure room, which in simple terms means all the air is being pumped outside. And if you do the tests of a person is in a room, a negative pressure room, and they have some sort of disease, how much of the air gets out underneath the door? The answer is basically none. So this is really a safe place to be. The likelihood of you getting a COVID infection in one of our facilities is extremely low. And it's much better that if you've got something else going on, we see you.
For sure.
Kelsey from Benton Ridge asks us, could we talk about the process for beginning surgical procedures again? You know, when, and what does that all look like? So,
well, it got moved up a little bit. I think from when we last talked, we thought it was going to probably be in the middle of May. And the governor's edicts of what have come out have, after he's looked at all the data, have said that we can open tomorrow, May the 1st. So we have been working on that. We obviously assumed that we would be reopening, and we have been working with our surgeons as well as with all of our staff to be able to open up and to do not only surgery but procedures. So what we had been doing were procedures and surgeries that could affect someone immediately if someone had cancer or it was life-threatening or really a big problem. Those things had been being looked at. We weren't doing a lot of those procedures, but we have been open. We have been admitting people that needed to come in. If you had an appendix or if you had a strangulated hernia or a kidney stone, those would be things that we've taken care of. We had to go on. Now we will start doing elective procedures. So someone that had things scheduled that were postponed, that's where we started, going back and talking to them to make sure, how are they doing? Were they prepared to have surgery? We are looking, then going through their history to make sure that there isn't any problem. They may be being tested to see if they have any kind of an infection or problem along with their preoperative evaluation. And then we are scheduling them through either at Finley or at Bluffton to have the procedure done. We're going through the complete process. We are opening up, but I don't want to say starting slowly. We're going to make sure that, because we're going to need to be using protective gear in some patients, the concerns are anyone that's going to be intubated or facially with anesthesia being around the face, that we make sure that we've prepared things. But I think overall the team has done a really good job of getting us ready to start back tomorrow morning.
So a couple more bits of detail, Kelsey. It's a really good question. Thank you. Our pain management program, which is a big program for Blanchard Valley, is starting again tomorrow. We have, I think the last number I heard was 17 people will be getting service tomorrow. We'll be giving you instructions. We'll be in touch with you, ask you about when we might schedule a procedure if you had one planned. There'll be all kinds of questions, I'm sure, about masks and gloves and hand sanitizers and the like. We'll tell you all about that. Can I have a visitor or a person bring me or not? We'll answer that question for you. So we've got a team of people internally that have been working on these processes over the last few days. And hopefully we'll have really clear answers for you. The one thing I would say is, to the extent you are unsure, call your surgeon's office. We have people there that can help you, and we want to take care of you. That's a really important point, and we will do it extremely safely. So to the extent we're not answering your questions or not responding as you would hope, please let us know. Amy from Finley is asking us, as we look forward, will the hospitals and surgery center extend daily hours temporarily to allow for more surgeries to be completed?
I think that remains to be seen, and let me explain why. One of the things we're just going to have to see empirically is how many individuals. We've talked about this safety, and I want to re-emphasize this. We think it's safe, but again, there's a lot of individuals out there that may decide, well, I think maybe I'll put this off a little longer. So it's going to depend on demand. I think also we want to make sure that we, from a safety standpoint for everyone, not only for our staff, but also for patients, that we do have our processes different. We're going to be doing things a little differently because we have to be concerned about COVID, about infections, but we will, as we see the demand, we have talked about adding on hours that we may be doing that. I know at the surgery center that they're working, I talked to one of their surgeons last evening about eye surgery, that they are ramping up to do that, but they've also put in new processes that they're going to do. So it'll be a little bit slower. Like I said, at the end of the day, it'll be how much do we think there's so much pent up that needs to be done about how we modify hours.
The other opportunity we have is our surgical suites in Bluffton. And I suspect many of you maybe have never seen those. They're lovely. They're really well done. So that's going to be some additional capacity that, quite frankly, oftentimes isn't as utilized as we wish it was. So we'll see how that goes. But I think Bill's right. We're playing this by ear, and we'll do what we need to do to get you taken care of. Danette from Finley is asking, do you have a time frame for outpatient offices to be open for procedures and tests?
Well, what came out from the governor yesterday is, along with, and I don't know exactly how they decide, along with veterinarians, along with dentists, that medical offices specifically are allowed to be open as to May 1st. So we will be opening up, but we have been open. We have tried to do things by telemetry. And one thing I might just ask you all that are listening, if you don't mind sending in sometime, what's your impressions of telehealth? We have adapted that very quickly. It seems to have been a positive. We're interested in how much we should pursue this. Should we be continuing? And I know the doctors are talking about that. So you might mention that to your doctors. How do you feel about that? What do you think? But we're opening up full without restrictions by the governor tomorrow.
David from Arlington is asking, some news outlets and politicians are calling COVID-19 a hoax. Since the numbers are much lower than projections, is this accurate? I'm going to ask Bill to comment, but before I do, I'd say this. What is definitely true is that the amount of COVID cases in a region of the country varies wildly. I think if you lived in New York City, I know if you lived in New York City, you would not ask or people wouldn't say it's a hoax. If you lived in Detroit, I have family that lives in Detroit, not a hoax there at all. There is, I forget the number in Texas of counties that have never had a COVID patient at all. If you get north of Lansing, Michigan, throughout the rest of the state of Michigan, I don't believe they had any COVID cases. And yet Detroit was one of the hot spots in the country. So I'll let Bill talk about the hoax part, but there's wildly varying prevalence. And I think that's made it hard for our elected officials to know what to do. I know for people that wanted to be critical of how our country's dealt with it, there's fodder for that. And I also think it's affecting how governors and cities are trying to open up again. So with that, Bill?
No, I completely agree with what you said. From a standpoint of just what happened in New York City and Detroit, and I think everybody would realize that not a hoax. I hope that we have learned something from what happened to them, that it may not have been as likely to occur in Finley to start with. We're more rural, but there certainly have been epidemics of different things that have happened in smaller communities that can occur that can be a lot of infections. Like I said, we learned from them. I mean, that's what the governor took. He took as much scientific evidence as he could find, tried to collect data, got opinions from all of the people that are involved, that have seen infections, that have been involved with the HIV epidemic, the SARS epidemics, and those kind of things, and tried to put together a package. I think the community, society, Ohio followed those standards, and we had probably a better outcome than what might have been expected, looking back 7 long weeks ago.
It's hard to believe it's been 7 weeks. Let me take a quick time out here. Anything coming in question-wise?
Yeah, people are wondering when the visiting restrictions might be lifted here at the hospital.
Well, that was a question we were going to get anyway, so go ahead, Bill. So what we have done, we made a decision early on, is that we would look at anyone that came in to the hospital. We would check them, as I talked about, and we decided after consultation, talking to not just locally, but what other hospitals were doing, and also the advice of the federal government through the CDC and Ohio to restrict visitors. That is still our policy. We have several places where we are in the process of looking. One of those is obstetrics, where obviously there could be a partner that is going to be there. We have been talking about the COVID positive, especially at the end of life. That was one of the more difficult things that I think we've ever had to deal with, just talking about it, to try from a public health standpoint, worrying about a surge, not enough protective devices as to how we were going to handle those. And now with surgery, the possibility of visitors coming in. So to answer the question right now, we have not made any changes, but we are in the process of evaluating that. That's on our list. We discussed it with our ethics committee today. We've talked about with risk management from a standpoint of, again, individuals not getting infected. We want to protect public health, but we need to balance that against the needs of an individual patient. And so I think there'll be more to come if we do this again, or we will be letting people know.
And Bill, I might add, and you, I know, would agree with this. Our teams that have looked at what's the right thing to do with a question like visitors have looked all across the country. One of the really positive aspects of this experience is the amount of sharing that's gone on coast to coast. And so we've learned a lot. We've looked at policies. One the other day we were talking about was a policy from a health system in Wisconsin. I know we got some early guidance from Seattle, Washington. And so it goes. So the rest of the country's struggling with the very same question about when to let visitors back in, how to let visitors back in, who gets visitors, who doesn't. Those are difficult questions. And Blanchard Valley will definitely be a part of the community of organizations around the country trying to figure out the best answer at a particular point in time.
Yeah, because we're trying to balance. There's not, I don't know that there's a right or a wrong answer, but you want to balance the benefit versus the risk of what can happen, and it's just difficult.
It is. One of our core values is we use the word compassion, and one of the definitions I use often for compassion is balancing the needs of an individual or a small group of people against the needs of an organization or of a larger group of people. And to me, this is a really strong test of our value of compassion. Obviously, anybody that's in the hospital wants to have visitors. Well, I say obviously, I'm sure there are some who don't, but the vast majority do, particularly if it may be an end-of-life situation. It's gut-wrenching to have to say, well, maybe we can't do that because of our interest in being safe for the greater whole. That's the kind of question we're being asked to wrestle with, along with the rest of the country. So this is a side note, but our values that we take pretty dearly here at Blanchard Valley have been tested regularly, and I'd like to say that they've helped us a lot in our decision making. Luann from Macomb asks, are there any long-term issues with, this is a good one, hearts, lungs, and kidneys, or will they heal and get back to normal?
That is a really good question, and unfortunately, we don't know the answer to that because of this. It's only been 4 months of what's going to happen. One of the things that is now one of the screening symptoms primary care doctors are asking individuals that are positive with COVID, have the COVID infection, may lose a sense of smell and a sense of taste. And some of those people have had that return and some haven't. Now that's not a major problem, but I was reading about the virus can attack all kinds of places. So what we think of it as respiratory, but it's been found that people have had diarrhea, they've had upset stomachs, it's affected their nervous system. So that would be the taste and the nasal. But there's also been studies done about mentation, about your thinking process of what happens. Now, I think most of us would say,
it's not that good to start with.
yeah, that's right. You got a problem before we ever get started, but that's beside the point. I think most of us would say if you're running a fever, you're not feeling good, you're not thinking as well. But there have been some studies that are being done that this may longitudinally, it may really have developed probably I'm going to use the word vasculitis, meaning an inflammation of the blood vessels to the brain, to the kidney, maybe even to the heart, that there may be some permanent effect, but we just don't know.
Yeah.
Another reason you don't want to get it, for sure.
Anything else, ladies? We doing okay?
One more question. Can a virus survive in a swimming pool, and can our pets be carriers?
The data,
Those are great questions.
yeah, the data so far on animals is not that they are carriers. Now, a lot of infections can come from animals, but it doesn't appear. I haven't researched that since the last time we talked, but there was this tiger that, and I have no idea why anybody, I don't even know how you put something down a tiger's throat to find out they were positive, but supposedly somebody checked this tiger and he was positive in New York. And I'm not making fun of it, but we don't think animals are a problem. And the other part of the question was, how long can they live? Or in a swimming pool?
Can it affect swimming pools? Yeah.
Yeah. I don't know that anybody has done any testing. I'll have to research that one. I would say this, that a swimming pool that has chlorine in it, that would be a pretty good disinfectant, because that does kill. We use bleach and those kind of things to kill, and this is a fairly sensitive virus that way. It's not like a bug called Clostridium difficile that chlorine or bleach doesn't kill. So I wouldn't think very long. In droplet form going into a swimming pool, it shouldn't be any kind of a problem. I think the concern about swimming pools has been much more the social distancing than it has been that you're going to pick up something from being in the pool.
Jennifer from Kenton asks, and we've answered this question, I'm going to touch on it real quickly. Have any Blanchard Valley Health System employees tested positive for COVID-19? The answer is no. And I'll add to that, and I kind of knock on wood when I say this, we have 2 nursing homes in our health system, and so far both of those have remained COVID-19 free, and that's lucky. But it's also a result that we're very pleased with so far, and I can only say that our leaders in our nursing home part of our organization are rather maniacal about trying to make sure that the residents there are as safe as possible.
You might mention, Scott, you were out, the CDC came in and checked out Birchhaven and some of the other nursing homes to see if we were following procedure, and
That's true.
We got a pretty good report back.
Center for Disease Control, CDC, came at our request to do a survey and tell us what we could do better to try and be safer. And I was very encouraged. I was lucky enough to get to go listen to the interview, which lasted a couple of hours, and then they did a walkthrough. And as I left, the gentleman said that I should be really pleased that our team was way ahead of the power curve compared to most that he'd seen. He had a few recommendations for us, which were helpful. So we asked him therefore, but the good news was there were no big gaps, none. And so that was great.
Yeah.
Danette from Finley asks, were any staff members laid off, mandated to take low census days, or had their hours reduced during this time? That's kind of 3 questions. I'm going to take a crack at it, and then you can comment too. We have had a number of associates take low census time. How that works depends on which area of the organization you work in. My experience with it, and please don't misunderstand, I don't know how every place resolves it. But generally, It's who wants to take a low census time, and there are volunteers to do that. And that if there aren't, it's based on a priority list of some sort. So yes, that has happened. Were any members laid off? We have had associates choose to go on unemployment. So far, we have not said to any one individual, you are laid off. So far. And then the last part, have had their hours reduced during this time? Yes, very definitely. And what we've tried to do for people that don't have as much work as they did before, we have a thing called a labor pool, and we've gotten some other jobs have occurred as a result of our response to COVID. A couple of obvious examples. We have people at the front door of a number of our facilities that ask you questions and take your temperature. Every single associate, every visitor coming in the Finley campus, for instance, has that every day. And there's usually 4 or 5 people that do that. Those are folks that had their hours reduced or their job didn't exist for a period of time. We also had a call-in location. There were somewhere between 2 and 4 people taking calls from the region, mostly the community, answering questions about should I come in and get tested, should I come in and get seen. Those are people also disaffected by this. We have a tent where people could come and actually, if they met criteria, have tests drawn. We also have an area where caregivers come and see patients that probably their primary care doctor would be happier if we took a look at them than if they did. So any other to add to that?
No, I don't think anything to add. I think maybe not all of our viewers are aware, but certainly our volumes are down. I think the question around the layoffs is just from a standpoint of income. We are not overwhelmed with COVID patients, as you've heard. Individuals are concerned, and I've already talked about that coming to the emergency room. But with us not doing elective procedures and the doctor's office is not seeing as many people, it certainly has been a financial impact to the institution. That's something that we're continuing evaluating, and that's, I'm sure, the reason for some of the questions.
And I'm going to touch on this in a question later on, but the financial impact on Blanchard Valley Health System has been dramatic. And I'll share some numbers with you here in a few minutes. Tina from Bluffton asks us, I have symptoms, would like to be tested, but was told I didn't meet the criteria. Could you please explain what criteria for testing means?
Well, we're back to when we originally started, and if you go back again to 7 or 8 weeks, the crisis began when we started talking to individuals around protective equipment, and we didn't have enough testing. Those were the 2 big things. So the criteria that were put out was if you didn't have a good reason to have the infection, which was difficult because it's respiratory. We were worried about a cough and things like that. And then you met criteria, cough, that you had a temperature of 100.4, along with now chills, a headache, a couple of new criteria that have been added. Additionally, at the beginning, and it's still part of the criteria, had you been exposed to someone with COVID? And those were developed nationally, primarily using the big cities about what had happened. And because we didn't have enough tests, those were the criteria that we had to use.
That's really the key too, right?
Yeah,
testing capability.
We set up, as Scott said, a tent where someone that would meet those criteria were dressed up in PPE, and we would check them. And if you didn't meet the criteria, we were not allowed to do the test because there was not an availability of testing. Now, what has happened is that there have been lots of different in the market of different companies that are preparing testing. We've been looking at those to make sure they're sensitive, so they pick up the disease. They're specific, so they don't pick up some other disease, because we want to make sure it's a good test. I've already talked about the broth, so it appears that it is going to be much more available in the next 2 weeks or so. Now, I'm not going to say that's going to be on demand. In other words, I walk in and say, I just want to have this test done, or I need a doctor's order to get it. I think we will get there, and I want us to get there because that's one of the ways we're going to be able to do something about this crisis. Can you go back to work? You're positive from a standpoint you either have the disease or you had the disease. Once we get those tests, it's going to make it a lot easier for everyone to be able to manage it. We're just working through that process.
Thank you. Susan from North Baltimore asks us, she's seen news reports of people becoming reinfected. You touched a little on this. Do we expect to see more of it?
I think it's just going to be as far as what we see as time goes on. Again, I've used the 4 months a couple of times, so we'll see if people get it. I think the other thing is we will have a lot more tests and be able to see that. If we could screen everyone and say, well, you apparently have had this already and didn't know it, then we're going to know if you get the symptoms again in 6 months or in a year, or what occurred. Hopefully, by the time we get an effective vaccine, we won't have to worry so much.
One of the reminders, I think we mentioned this before, some studies are showing up to 25% of the people that they test positive didn't even know they were sick. But that doesn't mean they weren't shedding the virus. It's a real concern to public health people. Steve from Mount Corey asked us, this is an interesting question. Is Blanchard Valley Health System collecting plasma from individuals who recovered from the virus? So Bill, you might want to make sure people understand what's inherent in that question.
So going back to when we talked about it, if an individual gets infected, so if I would become infected, my body is going to make chemicals called immunoglobulins that will be prepared to fight the infections. There's different ones. Some are immediately there. Some are ones that can regenerate and come back and can fight infection. So if you thought about that, well, it makes sense. I've been infected. I know I had COVID. I have antibodies in my bloodstream or in my body that will fight infection. If you took that plasma out of my body and gave it to someone else, there would be a theoretical chance that it's going to be improved. Plasma is part of your blood. So you've got red blood cells, you've got white blood cells, and you've got plasma. And a lot of people donate plasma. There are platelets in it. We use that very frequently after surgeries for blood clotting. So it's a proven, effective, fairly safe modality that you can use for infection. So now to answer the question, are we thinking about doing this? This has gotten a lot of press because it makes sense. It's one of those treatments, since we don't have any way to treat right now, that would make sense that we could help people. So what we've done, we have a relationship with Mayo, as I think most of you know. We've been in contact with them, and they have set up a study with the Federal Drug and FDA, Federal Drug Administration, to say we're going to allow you on a new kind of a procedure to proceed with some clinical trials. This would be research. So what we've done is we are applying to them. We talked to our ethics committee about this today, got the approval to move ahead. We'll have to set up policy and procedures so that someone that meets the criteria, I think from the Mayo, it's going to be fairly sick individuals that are in the hospital that need some kind of treatment, that we would be able to give them plasma. Now, to answer the specific question,
and then follow research protocols.
We have to make sure they meet the criteria, whatever those end up being. We have to measure it 4 hours. We have to measure it at 7 days, how someone's doing. We have to turn that in. And the reason for the research is we want to know whether this works, not rather than everything you're reading out there about all these different medicines that may or may not work. We want to know it works. It's going to be expensive. It's going to be a commodity. It's not going to be able to get, but we will be participating. Answering the question specifically, we will not be drawing the plasma, and this is not someone that will ask family to donate. We understand the plasma will come from Mayo. They will be involved, obviously, with this, but it may be a partial tool that we'll be able to use. That's our hope in the next couple of weeks or so.
And definitely an evolving modality.
Evolving, it'll be controlled from our standpoint or ordered by our intensivist and by Dr. Ratnasamy as far as meeting the Mayo criteria.
Good. Daniel from Cary says, in the beginning, I read that cloth masks will not protect you from the virus. If that's the case, why is the state requiring, you could add, why is Blanchard Valley requiring everybody to wear them?
Well, the first thing is, I think the question, it will not protect you from the virus. That's still pretty much what everybody thinks. The reason that we wear cloth masks, and I have my Buckeye one here, handmade, just advertising. Where's your,
It's a real beauty.
where's your Spartan one?
It's a couple feet away.
So that this mask is protection for me, not giving it to someone else. So it's going to catch droplets if I cough or if I do something. So that the reason, though, that it was decided originally when we started talking about this, and I'm talking about healthcare in general and the feds and everyone else, there were not enough masks. Protective equipment was a big concern, and we didn't want the individuals that really needed it, healthcare workers, EMS, the front line, to not have masks. And we didn't really even have many cloth masks. At that time, there were N95s that really filter out the virus. In addition to that, cloth masks or surgical masks that were being used that we routinely use. And so with that, it's evolved into, well, this will protect other people. I'm a believer in the mask. It was a little uncomfortable, to be honest, when I went out shopping, my weekly grocery shopping, to be wearing a mask. Not everybody else was, but I got used to it. I don't think I looked that much different. The other thing is it is symbolic. It is showing people to remember this. And the third thing I think a mask is useful is it's kind of hard to touch your mouth or touch your eyes. I guess you can touch your eyes, but your mouth or your nose if you have a mask on. And that is still a key as to how you are going to get this, is by picking up a droplet somewhere, somebody sneezes, coughs on you, and you touch your mouth or you touch your face. So that would be my answer for mask. And I think the governor did back off a little bit from his, I would have agreed with what he originally said. Everybody should be wearing a mask in public. I think maybe that ought to be, in my opinion, I've been asked that. I think if you're out walking and you're 6 feet apart and you're in the air, that is pretty not risky. And I don't think you should wear or need to wear a mask. But when you're around other people, especially if you're shopping or doing things, it just makes sense to be wearing a mask.
You know, the other part, and this is just anecdotal, but I was in the grocery store the other day and I had one on, and I noticed most people were, but it also kind of reminds you to not get too close.
Yeah, it does. I think it's just,
so there's just a benefit.
on the other hand, you know, you kind of like to see somebody smile. I can't tell if they're smiling or
Well,
not.
that's true. There's no question about that. Hopefully we won't have to do that forever. When will the antibody test be available in Finley, and who gets the test?
Well, I think we're back to that. Now, this is a little different test. Reminder, the first test is, do I have it? That's an antigen test. Do I have the virus? The antibody test says, did I have the disease? And it is becoming more available. It is going to be a blood test, serological test. I think we'll be able to find it. The problem is, I surveyed this group before we talked. There's one person that we know of the 6 of us that have COVID. Now, there's probably more out there in the community because we haven't been able to do the testing, but it doesn't make a whole lot of sense to be doing a lot of antibiotic testing here when we don't think there's very many people that have had it, but it is going to be available.
Marcia from Finley asks, how do I make monetary donations to BVHS? Well, a couple simple ways. One is you can contact our health foundation. That number is 429-6414, excuse me, 419-429-6414, or you can visit vvhealthsystem.org /give. So that would be appreciated for sure. Daryl from Bluffton asked us a question. How do you think COVID-19 is financially impacting hospitals and health systems across the nation? The answer is dramatically, Daryl. On average, from what I can tell, and I've been on all kinds of calls, federal calls, White House, talking to the White House, talking to Centers for Medicare and Medicaid Services, talking to the American Hospital Association. Somewhere between 50 and 60% of our revenue being lost is pretty common. To put that in terms from Blanchard Valley, we're trying to as you might imagine, figure out what's our projections going forward against our budget. And we have no idea, to be honest with you, how good our guesses are, because we don't know what's going to happen as society opens up a little bit. Are we going to see another spike or bump of COVID cases, and are we going to shut everything down again? You know, we don't know what's going to happen, but I think it's pretty safe to tell you that over the course of this year, our revenues will be affected by somewhere in the vicinity of $60 million. And for an organization our size, that's 15 to 20% of our revenues. That's a big, big hit. And I think we're pretty typical around the country. So the government's trying to help, and I think they will and are, and appreciate that. But when our elected officials made the comment early on, we have to fight this disease at all costs, I honestly don't believe anybody had any idea what all cost meant. And I think we're learning the number was astronomical, quite frankly. We got 5 or 6 minutes, and let me quickly check with our crew back here. Do we have any new questions?
We have a question about what your opinion on whether you think that all of the tight restrictions are overkill at this point.
Well, the question, if you didn't hear that, was are they overkill with where we are with restrictions? So I'm going to go back to the balancing the risk versus the benefit of whatever we do. I think there's always going to be second guessing. What the governor has said, the decisions he's been made, as Scott has talked about, have got to been really difficult for everyone. But specifically right now, I'm a believer, and I've mentioned that a little bit, that I think we can start to open those things up. So if you say right now, maybe we were being a little bit over restricted. I think at the end, I'm going to talk a little bit about what my thoughts would be going forward. Maybe I'll just leave it at that.
Okay. I would say this, in retrospect, yeah, probably, but that's really unfair. When we saw the first models of what we thought could happen in this country because of what was going on in Seattle, Washington, San Francisco, California, New York City, Detroit, those were really the hot 4. It scared the heck out of everybody. Had we seen that kind of activity coast to coast, well, I think the restrictions that we put in place helped ensure that didn't happen all over the country. So can we learn from that? I think we can. I think it's what Dr. Coates was just talking about. I think we are. We're going to start some experiments here around the country. Ohio, really our experiment starts tomorrow morning. And as we finish, I wanted to turn it over to Bill because as society opens up a little bit, as Finley opens up a little bit, or the Finley area, I want to give him the chance to offer some encouragement, but also some words of warning, because this isn't a hoax. That virus really exists, and for many people, you don't want it. So with that, Bill?
Yeah, maybe just a couple of thoughts. So I mentioned a little while ago that there's only one of us of the 6 here that knows someone personally. I would love to be able to say in a year when we go back and say, gee, we never met anybody that had. And I think that's absolutely impossible that can happen. And that is partly related to the virus, partly about what's happened. Now, does that mean that we're going to have a tremendous problem or a tremendous surge? I don't think so. I'm going to address that in a minute. But it is certainly, from a standpoint of the scientific theory, until we get 60% of the population, I personally think that's a little low, but until either have had the disease, so they have the antibodies and they can't spread it and hopefully not get it again, that's going to make it even worse, or we get a vaccine. And I haven't read anywhere, even the Oxford group that looks like they're in phase 2 of a trial, they're still saying it's going to be a year. So that means that individuals are going to get infected. And if we surround ourselves, we say, okay, we can quarantine Hancock County, nobody's going to come in and nobody is going to leave, and we're going to make sure that we don't get the infection, that's going to still be very difficult. We're going to see outbreaks. Scott's right. I think we've been lucky in our nursing homes. I think we have followed every policy we can, and so have the other nursing homes. There's going to be asymptomatic people, meaning they don't know they have it, that they're going to carry it in from somewhere, and we're going to see infections. So from a standpoint, no, this is not a hoax. And I think that would really be not the question, but people thinking that. I was told Scott today, 100 doctors died in Italy. That's doctors, not counting nurses and everyone else from trying to fight this virus. This is a virulent disease that is very contagious and has tremendous side effects to some people. So to all of you, it is still really important about the things that we need to do. Social distancing is important. Now, does that mean we have to social distance all the time? No, I talked about those things. If you wear a mask, it's going to be protective. If you stay 6 feet away, if you wash your hands, if you sanitize, if you limit the exposure to lots of people, that is going to reduce the risk. It doesn't mean that we won't get things, but hopefully we have certainly seen in Northwest Ohio, and especially in Hancock County, we have not seen the disease that we thought. But that's because everybody has done that. And everyone that's related to infectious diseases, doctors are concerned as we start to do that. I don't think it's an either or. I think it can be an and. We can start to open up, but people need to do the things that I talked about. And I think we need to trust each other. There's a lot of people that could be but it's not just healthcare workers, the delivery people, the fellows that are making pizza. All of those people are important, that they need to be doing this. We need to encourage each other. People are starting to get socially isolated. We have loneliness. We have all kinds of things going on. But I think together we can at least start this, and we'll see what happens. If we start to see an outbreak, the governor said that, and so is everyone else, we are going to have to go back and start to make sure that we follow these rules more than what we have, and maybe we'll have to close things down. That remains to be seen.
Right. By the way, I feel pretty strongly about the pizza guys.
Yeah, I know. Well, we need those people. I mean, there's no way you can't close down everything. Yeah, I really missing Dietz's. I don't know about it.
Well, that's a good point too. For those of you that might be watching from out of town, there's a chocolatier ice cream maker in our town called Dietz's that sends stuff all over the world. It's amazing. People come from all over the United States to stop into Dietz's. So if you get stuck on it, it's awfully good, and we do miss it, don't we?
Yeah, I hear they'll bring it outside if you.
I tested that out the other day. It actually worked.
You got your mom's?
I did. Yep. Yeah. So we're upon the appointed hour. Thank you again for tuning in. Hopefully it was useful. Really important that you give us feedback. We can do this again in 2 weeks if it's valuable. If it's wearing out, our feelings won't be hurt. I'll say it that way. But it's a privilege to get a chance to chat with you all today, and I want to thank our production crew here. There's multiple people in this room that you can't see that help make today happen. If there are further questions, we'll be glad to try and get back to you with those answers. In the meantime, as we do open up as a state, think about that as a positive. We got to figure this out, but be careful. Follow the rules that we know work, and I think we'll all be a lot safer and a lot happier. Thank you. Thanks for being with us.